content provided in this dental reviewer is if for educational and informational purposes only. It is not affiliated with, endorsed by, or officially recognized by the Professional Regulation Commission, PRC, the Board of Dentistry, or any official licensing body in the Philippines. All questions, explanations, and materials in this reviewer are generated using ChatGPT and are based on general dental knowledge, textbooks, and publicly available resources. This reviewer does not contain actual board exam questions and should not be considered a guaranteed way to pass the dentistry, dental technology, or dental hygiene board examinations in the Philippines. While we strive for accuracy, we encourage viewers to consult official references, textbooks, and review centers for comprehensive preparation. The creator of this content is not responsible for any errors, omissions, or exam outcomes based on the use of this reviewer. By watching and using this material, you acknowledge that it is intended as a study aid and not as a substitute for professional education, training, or official review courses.
Oral Physiology Mock Exam Reviewer 1 to 50 Part 3.
1. Which cranial nerve is primarily responsible for innervating the muscles of mastication? A. Facial nerve. B. Trigeminal nerve. C. Glossopharyngeal nerve. D. Hypoglossal nerve. Answer B. Trigeminal nerve. 2. The trigeminal nerve is also known as A. Cranial nerve 3, B. Cranial nerve V, C. Cranial nerve 7, D. Cranial nerve 9. B. 3. The motor root of the trigeminal nerve supplies which of the following structures? A. Muscles of facial expression. B. Muscles of mastication. C. Tongue muscles. D. Salivary glands. Answer B. Muscles of mastication. 4. The sensory root of the trigeminal nerve transmits sensation from A. The muscles of mastication. B. The skin of the face and oral cavity. C. The intrinsic muscles of the tongue. D. The autonomic nervous system. The skin of the face and oral cavity. 5. The ophthalmic division of the trigeminal nerve exits the skull through A. Foramen rotundum. B. Foramen ovale. C. Superior orbital fissure. D. Infraorbital foramen. Answer C. Superior orbital fissure. 6. The maxillary division of the trigeminal nerve exits the skull through A. Foramen ovale. B. Foramen rotundum. C. Stylomastoid foramen. D. Superior orbital fissure. B. Foramen rotundum. 7. The mandibular division of the trigeminal nerve is A. Purely sensory. B. Purely motor. C. Mixed sensory and motor. D. Part of the autonomic nervous system. Answer C. Mixed sensory and motor. 8. The nasociliary nerve is a branch of which trigeminal division? A. Ophthalmic. B. Maxillary. C. Mandibular. D. Facial. Answer A. Ophthalmic. 9. The lacrimal nerve is responsible for A. Sensory innervation of the upper lip. B. Secretory function of the parotid gland. C. Sensory innervation of the lacrimal gland. D. Motor function of the eye muscles. Answer C. Sensory innervation of the lacrimal gland. 10. The frontal nerve is a branch of A. Maxillary division. B. Mandibular division. C. Ophthalmic division. D. Facial nerve. C. Ophthalmic division. 11. The nasopalatine nerve innervates the A. Soft palate. B. Hard palate anteriorly. C. Upper lip. D. Cheek mucosa. Hard palate anteriorly. 12. The greater palatine nerve supplies sensation to A. The soft palate. B. The posterior hard palate. C. The anterior hard palate. D. The upper lip. Answer B. The posterior hard palate. The lesser palatine nerve supplies A. The anterior hard palate. B. The upper gingiva. C. The soft palate and tonsils. D. The mandibular molars. Answer C. The soft palate and tonsils. 14. The posterior superior alveolar nerve, PSAN, innervates A. mandibular incisors, B. maxillary molars except the mesiobuccal root of the first molar, C. maxillary premolars, D. mandibular premolars. Answer B. Maxillary molars except the mesiobuccal root of the first molar. 15. The middle superior alveolar nerve, MSAN, provides sensation to A. maxillary incisors, B. maxillary premolars and mesiobuccal root of the first molar, C. mandibular molars, D. mandibular premolars. And B. maxillary premolars and mesiobuccal root of the first molar. 16. The anterior superior alveolar nerve, ASN, supplies A. the soft palate, B. the maxillary incisors and canines, C. the maxillary molars, D. the mandibular incisors. Answer B. the maxillary incisors and canines. 17. The auriculotemporal nerve supplies A. the maxillary molars, B. the temporomandibular joint, TMJ, and external ear, C. the maxillary premolars, D. the soft palate. B. the temporomandibular joint, TMJ, and external ear. 18. The long buccal nerve provides sensation to the A. buccal mucosa of the mandibular molars, B. maxillary premolars, C. hard palate, D. soft palate. Answer A. buccal mucosa of the mandibular molars. 19. The lingual nerve provides general sensation to the A. buccal mucosa, B. tongue's anterior 2/3, C. soft palate, D. parotid gland. B. tongue's anterior 2/3. 20. The inferior alveolar nerve, IAN, enters the mandible through the A. infraorbital foramen, B. mandibular foramen, C. mental foramen, D. greater palatine foramen. Answer B. mandibular foramen. 21. The mental nerve exits the mandible through the A. infraorbital foramen, mandibular foramen, B. mandibular, C. mental foramen, D. incisive canal. C. mental foramen. 22. The incisive nerve is a continuation of which nerve? A. posterior superior alveolar nerve, B. infraorbital nerve, C. inferior alveolar nerve, D. lingual nerve. Answer C. inferior alveolar nerve. 23. The deep temporal nerve innervates the A. masseter muscle, B. temporalis muscle, C. buccinator muscle, D. mylohyoid muscle. Answer temporalis muscle. 24. The mylohyoid nerve is a branch of which major nerve? A. facial nerve, B. inferior alveolar nerve, C. lingual nerve, D. auriculotemporal nerve. B. inferior alveolar nerve.
25. A root canal treatment RCT of tooth 35 requires anesthetizing which nerve? A. posterior superior alveolar nerve, B. middle superior alveolar nerve, C. inferior alveolar nerve, D. lingual nerve. Answer C. inferior alveolar nerve.
26. Which of the following cusps provides primary support in occlusion? A. upper buccal, B. lower lingual, C. upper lingual, D. lower incisal. Answer C. upper lingual. 27. The non-supporting cusp in the mandibular dentition is A. lower buccal, B. lower lingual, C. upper lingual, D. upper buccal. Lower lingual. 28. The cheek provides lateral support to which dental arch? A. maxillary, B. mandibular, C. both arches, D. neither arch. Answer A. maxillary. 29. Which of the following structures helps stabilize the mandibular teeth? A. cheeks, B. tongue, C. lips, D. hard palate. B. tongue. What is the primary significance of ABC contacts? A. Maintains alignment and occlusion of the dentition. B. Causes malocclusion. C. Creates an open bite. Leads to tooth wear. Answer A. Maintains alignment and occlusion of the dentition. The curve of Spee is best described as A. The lateral curvature of the occlusal plane. B. The anteroposterior curvature of the occlusal plane. C. The vertical inclination of the teeth. D. A straight plane of occlusion. Answer B. The anteroposterior curvature of the occlusal plane. 32. The curve of Wilson is best described as A. The lateral curvature of the occlusal plane. B. The anteroposterior curvature of the occlusal plane. C. The horizontal alignment of the teeth. D. A plane that divides the maxilla and mandible. Answer A. The lateral curvature of the occlusal plane. The curve of Spee is seen when viewing the dental arches from the A. Frontal plane, B. Sagittal plane, C. Horizontal plane, D. Occlusal plane. Answer Sagittal plane. 34. The curve of Wilson is observed in which plane? A. Frontal, B. Sagittal, C. Horizontal, D. Occlusal. Frontal. 35. Open bite is commonly associated with A. Tongue thrusting, B. Thumb sucking, C. Incorrect eruption sequence, D. All of the above. D. All of the above. The occlusal contact between maxillary and mandibular teeth helps to A. Maintain proper occlusion, B. Prevent malocclusion, C. Provide stability in the dental arches, D. All of the above. Answer D. All of the above. 37. Which type of contact is involved in occlusion? A. Mesial contact, B. Distal contact, C. Proximal contact, D. Occlusal contact. D. Occlusal contact. The plane of occlusion is determined by A. Curve of Spee and curve of Wilson, B. Tooth alignment, C. Jaw movements, D. All of the above. D. All of the above. 39. The reference plane that divides the body into left and right halves is A. Frontal, B. Sagittal, C. Horizontal, D. Transverse. Sagittal. 40. The plane that divides the body into front and back halves is A. Frontal, B. Sagittal, C. Horizontal, D. Coronal. A. Frontal. 41. The horizontal plane divides the body into left and right halves, B. Front and back halves, C. Upper and lower halves, D. None of the above. Upper and lower halves. 42. Which of the following is not a function of neuromusculature in dentistry? A. Jaw movement control, B. Tooth eruption guidance, C. Chewing efficiency, D. Saliva production. Answer D. Saliva production. The correct eruption sequence of primary dentition is A. Incisors, first molars, canines, second molars. B. Canines, incisors, first molars, second molars. C. First molars, incisors, canines, second molars. D. Incisors, canines, first molars, second molars. Answer A. Incisors, first molars, canines, second molars. The correct eruption sequence of permanent dentition is A. First molars, incisors, canines, premolars, second molars. B. Incisors, canines, first molars, second molars. C. First molars, incisors, premolars, canines, second molars. D. Incisors, first molars, canines, premolars, second molars. Answer A. first molars, incisors, premolars, second molars. 45. The eruption of primary dentition is usually completed by A. 1 year, B. 2 years, C. 3 years, D. 4 years. Answer C. 3 years. 46. The last permanent tooth to erupt is typically the A. First molar, B. Canine, C. Second molar, D. Third molar. D. Third molar. Proximal contact is the contact between A. Upper and lower teeth, B. Anterior and posterior teeth, C. Adjacent teeth in the same arch, D. Occlusal surfaces.
Answer: C. Adjacent teeth in the same arch. 48. Factors that determine tooth position include occlusal forces, B. Soft tissue pressure, C. Neuromuscular function, D. All of the above.
Answer D. All of the above.
49. The occlusal contact between maxillary and mandibular teeth is essential for a tooth stability, B. Proper occlusion, C. Prevention of wear, D. All of the above. Answer: D. All of the above.
50. The curve of Wilson contributes to A. Lateral balance of occlusion, B. Anterior guidance, C. Vertical jaw movements, D. None of the above. Answer A. Lateral balance of occlusion.
How did you do on the mock exam? Share your score in the comments below. Thanks for watching. I hope this mock exam helped you in your review. If you want more dentistry, dental technology, and dental hygiene reviewers, make sure to like, share, and subscribe to John Ryan Magalona. See you in the next video. Keep studying and good luck on your exams.